The goal of this video is to provide information about breastfeeding so that you can make an informed decision about how to feed your baby. How you feed your baby is your choice, and we're not trying to pressure you in any way, but we found that many of our patients have similar questions and concerns about breastfeeding. We hope this video will give you a better understanding of what to expect and the type of support that you'll receive from our staff while you're here.
Breast milk is the perfect food for babies. It has the right amount of proteins and fat and antibodies, and it's just very digestible for the babies, and it's important for brain growth, that it keeps them healthier. Their guts are healthier, so their immune systems are stronger, which reduces their risk for obesity later in life, asthma, type 2 diabetes. It gives them everything that they need to grow in their first 6 months of life. There's great benefits even for mom, not just for babies. It helps her bleed less after delivery. It helps her get to her pre-pregnancy weight sooner. It also reduces her risk of breast and ovarian cancer and her risk of type 2 diabetes as well.
Mothers have great benefits from breastfeeding, including things like increased bonding with their baby, decrease in postpartum depression, decrease in the amount of bleeding they have postpartum, as well as a number of calories that you lose every time you breastfeed.
Research has shown that one of the best things you can do for your newborn is to hold them skin to skin. This means that your baby is naked except for their diaper and held to your naked chest with no clothing or blankets between you or your baby. A blanket should be placed over your baby's back to help keep him or her warm. Skin to skin helps your body make more milk and doubles your chances for successful breastfeeding. It also helps stabilize your baby's heart rate, breathing, temperature, and blood glucose levels. Babies that are held skin to skin are 12 times less likely to cry. In the hospital, we will place your baby skin to skin as soon as possible after birth. We delay weighing your baby and giving your baby the newborn medications until after this precious time.
I think the skin-to-skin interaction between mother and baby definitely helps bring that bond closer. It comforts the baby as well as comforting the mother.
You know, if mom and baby are separated, baby can feel a little bit of stress, and they start releasing cortisol, which is a stress hormone, and so they can be, fussier, and they can feel like they're threatened. If they're skin to skin with mom, they feel very secure, and it brings mom's stress levels down as well. Here at Signature Healthcare Brockton Hospital, all of our babies room in with our moms. We don't separate them. We don't use a level 1 nursery or a well baby nursery. We want our moms and babies together.
The baby is just born and everything is new, and the comfort that is provided for the baby from the mother, that's one of the most important reasons we want babies and moms to room together.
Research shows that moms sleep better with babies in the room because baby's right there, and she gets to know her baby's cues, and so that she can learn her baby and how often the baby wants to eat and get to that baby and feed that baby sooner so that baby's not fussy.
Research has shown that the mom should be feeding the baby at least 8 times in a 24-hour period to be most successful. It's best to feed the baby on demand whenever the baby seems interested, instead of looking at a clock or trying to get a certain amount of feedings in per day. Sometimes babies are going to want to eat very frequently throughout the day, and some days babies want to eat more frequently. Sometimes babies do something called cluster feeding, where they want to eat almost every hour, and that's a good thing because it's helping moms' bodies know how much milk to make.
Your baby's gonna tell you when they're hungry. So they're gonna start waking up, maybe they're gonna start moving their eyes around, maybe moving around in the crib. Those are our very early feeding cues. And then next, they're gonna open their eyes, they're gonna start smacking their lips, they're gonna be trying to find their fingers and their fist and bringing them to their mouths, and really kind of turning their head looking for the nipple. I wanna catch them before they start crying, because crying's a late cue, and once they start crying, now I have to calm them down before I can latch them on. If I can catch them early and get them latched on, I'm going to get a much better latch.
Position and latch are really important for establishing successful breastfeeding. When the baby is positioned correctly, they'll have their mouth open really, really wide, and they'll be taking as much of the breast tissue in the mouth as possible. That will allow the baby to get milk out efficiently.
There's all different types of positions that we use. Most commonly is the cradle hold, where you're kind of holding your baby in your elbow and holding like that. There's also the cross cradle hold. There's the football hold, which I love to use with my C-section moms because it doesn't put any stress on the incision. And then there's some laid back nursing where they just kind of chill out a little bit. So there's all different ways that we can get your baby latched on and positioned so that it's comfortable for you and comfortable for baby. It may seem easier to give your baby a bottle in the very beginning when they're wanting to nurse so often and you're exhausted because you just gave birth and they're nursing every hour, but it actually can be detrimental to breastfeeding.
There's a lot of differences between breast and bottle feeding. Babies use a lot of muscles when they're breastfeeding, and they don't use those same muscles when they're bottle feeding. Also, when they're feeding from a bottle nipple, the flow of formula comes out really, really fast, which is just totally unlike the flow of breast milk. And so when a baby gets used to that flow, they develop a preference for how easy it is. So when the baby gets used to bottle feeding, they may have difficulty latching on, and they may have less patience to stay on the breast.
Sometimes there's a medical reason why your baby might actually need either donor milk or formula. And usually it's related to they've lost too much weight, or they have hyperbilirubinemia, or they have hypoglycemia, and we just don't have enough of your milk yet to kind of compound those medical issues. So we're gonna suggest that you supplement with formula. The key is to put your baby to breast first and then offer the supplement. And again, we don't want to use an artificial nipple, so we're gonna use alternate feeding methods, such as a spoon. We will hand express some of your colostrum, put it in a spoon, feed a baby that way, maybe a little medicine cup, or even a syringe where they can suck on a finger and we can syringe feed them that way. So there's lots of different ways that we can approach giving your baby formula that's needed without causing a nipple confusion or issues with breastfeeding.
Thank you for taking the time to view our video. We hope it has been helpful in providing information about breastfeeding, and we hope we answered any questions you may have had. If this video brought up any additional questions or concerns, please talk with your provider at your next visit. If you are not planning on feeding your baby breast milk, please discuss this with your provider so we may review safe formula preparation.